So recently at ASH this past year in 2012, Dr. George and his group presented some very interesting data looking at sort of the same ideas with a little bit longer follow-up, looking at the mortality and morbidity in these group of patients when followed long-term in a systematic fashion. So the idea here, the objective, obviously, as you can see in this slide, is to document the long-term outcomes of patients following recovery from TTP. And these, again, were TTP episodes, a uniform population that were severely deficient in ADAM-TS13 activity. These patients were contacted over the years 1 or 2 times per year. They attended roughly, on average, 3 patient support group meetings at the University of Oklahoma, and were seen in the clinic at least once per year to help get a better hand on some of these long-term complications and issues. 57 patients who survived the initial episode were studied. The median age was 39, so again, quite young for expecting long-term complications that we're going to be talking about. Predominantly female, and 40% of patients nearly were African American that were included in this study. Looking at the comparison of the diagnosis, the incidence, the diagnosis of hypertension at their presentation with TTP compared to during follow-up, no difference at their initial presentation, but when looked at in follow-up, there were significantly higher numbers of patients with hypertension compared to the adjusted U.S. population norms. Again, suggesting these patients developed longer-term complications of their TTP. Again, hypertension that wasn't present previously. Very similar, I would say, to our patient cohort and the 2 patients who developed hypertension during follow-up. If we look at the diagnosis of diabetes, and it's certainly known that patients who are heavier seem to be a greater risk for TTP. In this particular study, there was no significant difference in the BMI measure of obesity in patients at diagnosis and at follow-up. So certainly increasing weight doesn't account for what we see here, which is an increased number of patients diagnosed with diabetes at follow-up compared to those at presentation. So again, I believe this is likely more than just weight, but it's suggesting other factors may be in play here in the development of diabetes in these patients with a previous history of TTP followed up. Sort of interesting that we see whether you use the glomerular filtration rate as a measure of kidney function or use the albumin-creatinine ratio, there doesn't appear to be a significant difference in kidney function as we measure it. But I think this may be very similar to our data where we had normal kidney function as measured by the serum creatinine, but yet kidney biopsy at autopsy unfortunately suggested very severe kidney injury. So I think this data may be very consistent with ours and suggest that the present ways we measure kidney function may not be sufficiently sensitive to pick up kidney complications in patients with TTP previously. So I think the most striking and maybe sobering data is looking at the probability of survival in patients with a previous diagnosis of TTP. Again, this is a uniform population of patients, ADAM-TS13 deficient, compared to adjusted norms from the U.S. population. In the dotted red lines, you can see the confidence interval, sort of suggesting patients with a previous diagnosis of TTP have a shorter life expectancy. But I think the more important question for patients is, why is this happening? You can see numerically at 1 year there's a 98% chance of surviving. At 5 years it drops to 90%. 10 years almost 80%, 77%. And 15 years after the initial episode, only 67% of patients have survived their disease. And this doesn't make a lot of sense on the surface when we talk about the improvement in the outcomes and treatment of TTP patients. And indeed, if you look more carefully, it's not just the fact that these patients died, but it's important to look at how they died. Certainly one patient died of a relapse of TTP that was confirmed by autopsy. What you also see is a lot of other non-TTP related causes that I think are very consistent with the data that I've been talking about and showing today. One patient died of a myocardial infarction following recovery from TTP with no evidence of active TTP at autopsy. 9 deaths with no evidence of TTP relapse. You're seeing cardiovascular-related disease and death-related causes in 4 patients, ovarian cancer in 1. But certainly you see a patient with a stroke problem, a history of a stroke leading to the death that was believed, as well as cirrhosis and intestinal hemorrhage. So I think what this sort of gets our attention is that these these long-term complications that we see in patients with TTP are not just a nuisance. They really are significant problems that need to be addressed to help prevent some of the morbidity and mortality. So I think what's encouraging as well as sobering, we see the long-term complications and increased mortality in TTP patients. But I think what we should see is the opportunity to intervene earlier with the awareness of these problems to prevent these non-TTP deaths.